Hello friends, Chris here, and we're going to do another video today. It's going to hopefully help with the symptoms of COVID, either in the acute phase or if you have long COVID. Now, I'm going to show you 3 acupressure points from traditional Chinese medicine that can help relieve some of the symptoms. Before I do that, I need to do a wee disclaimer and a word of caution. The disclaimer, obviously I'm not a doctor, I'm not a GP, I'm not a nurse, I'm not a Chinese doctor. So if you have any kind of health issue that you're concerned about, your first stop is to go and speak to your doctor, not go to YouTube. What I'm going to show you is just for information purposes, and if you want to try it, you do so at your own risk. The second is a word of caution. If you want to try acupressure, be careful. Especially when you're doing acupressure on specific points of the body. If you want to do this, you need to be careful you're not applying pressure to a part of the body that has an injury or a scar. I would avoid this. If you are frail, if you're physically not a strong person, I would not recommend this. And if you're a woman who's pregnant, I would not recommend this. In these occasions, I would suggest you go and see an approved doctor of traditional Chinese medicine. Again, if you are interested in acupressure or acupuncture, I would always recommend going to see a doctor of traditional Chinese medicine. I know there are NHS occupational therapists that are trained in acupuncture. However, that is not the same as a practitioner of traditional Chinese medicine. There are 2 different approaches to healing and medicine. So what I'm going to show you is the traditional Chinese medicine approach, how I understand it. Again, I'm not a doctor, I'm not a nurse. I'm a teacher of Tai Chi Chuan and Qigong. I know a wee bit about traditional Chinese medicine. So I'm going to share with you what I know that's going to help, hopefully, with either COVID in the acute phase or long COVID. Okay, I'm going to show you 3 points that a Chinese doctor would apply an acupuncture needle. However, obviously, I'm not going to be sticking needles in myself, and I'm not going to recommend you do that for yourself. If you are interested in acupuncture, go and see a Chinese doctor. However, you can apply gentle pressure to these points that will help with symptoms, relieve symptoms. So why not just do that anyway? Why have acupuncture? Well, with acupuncture, it's a very fast and effective way of relieving symptoms, and it might only require 1 treatment of acupuncture to actually relieve the symptom. With acupressure, because you're not applying a needle, you're applying gentle pressure either with the thumb or the finger. It might take a wee bit longer. You might have to do a wee bit of acupressure every day for a few days or maybe in a few weeks to relieve the symptoms. So acupuncture does it quickly, very effectively. Acupressure, it takes a wee bit more time. Okay, so here we go. First one we're going to do, these 3 acupressure points are basically to help with a symptom of COVID, sometimes described as brain fog. What this basically means, some people experience either with COVID in the acute phase or with long COVID, problems with cognition, problems with memory, problems with reasoning. It is to do with, from research basis, it's to do with an impaired flow of blood to the brain. It does appear COVID does affect blood flow to and within the brain. So what I'm going to show you is 3 acupressure massages, self-massages, that will help improve blood flow to the brain. Okay, so the first one I'm going to show you, and again I apologize for my appalling Chinese pronunciation, is called Feng Qi, which basically translates as the wind pulls. In acupuncture, it's known as GB20 point. Okay, so to do this, I'm going to about face here. It's easier to see this if I'm about face, because the wind pull points are at the base of the skull, at the back of the skull. Okay, so first thing you're going to do is take your fingertips, bring them up to the side of the skull. Okay, you're going to take the pads of your thumb tips and you're going to gently bring the thumbs down the back of the skull until you reach the base of the skull, sometimes known as the occipital point. Now, you might find that leaning the head forward a little bit actually helps to find that point. So you're looking for the base of the skull, you're looking for a hard ridge at the base of the skull, and then just below that, you'll find an indentation at the base of the skull where it gets soft. And this is the muscles and the tendons that run at the back of the neck, either side of the spine, that go down to the trapezius muscles in the shoulder. So again, you're coming down with the thumbs to the base of the skull. So you're going from when it goes hard to soft, and you'll find there's an indentation, that there's a recess at the base of the skull, and it's either side of the spine. Now, once you get that point, rest the fingers on the skull, okay, and then gently massage in a circular pattern in that recess, in that indentation at the base of the skull. And you only need to do it for about a minute or two. Just give it a gentle circular rub. Now, when you do this, okay, you're not just brushing the skin. What you want to do is you want to feel it. So you're not pressing too hard so you're in pain, but you do want to apply a wee bit of pressure when you do a circular rub with the thumb tips. And again, you just do it for about a minute or 2 minutes if you can stand it. Okay, so that's the first one. So that is the wind pools, Feng Qi, GB20. Now, in traditional Chinese medicine, the blood is always paired with what the Chinese call qi, energy, or sometimes known as breath. Okay, so in yin-yang principle, okay, the blood is always yin, and associated with the blood is always qi, which is always yang. So what we're doing with massaging the wind pools is we're stimulating blood flow to the brain, but what we also want to do now is stimulate qi flow to the brain as well. So what we're going to do is the next acupressure point is called the Wei Hui point, or the meeting of 1,000 channels, and it's the topmost acupuncture point, and it's at the very top of your skull. So what we're going to do, we're going to take the center of the palm, we're going to bring it up, and we're going to rest at the top of the head. Now, it's very important when we do this one that we sit nice and straight and we keep the head up. The Chinese say it's also almost as if you're balancing a cup of tea on top of your head. Okay, and you bring the chin back towards the spine, you empty the collar, as the Chinese say. Center the palm, you rest it on top of the head. You don't need to press down. The weight of the hand is sufficient. And again, what you do is a circular rub. And again, you just need to do this for about a minute or two. And the Chinese say this helps promote the flow of yang qi, the top of the head to the Bai Hui point. So we're increasing blood flow, but we also want to stimulate the flow of qi to the brain. And the Chinese say this helps with consciousness, improved consciousness, or what we might say awareness of experience, awareness of everything that the brain can potentially be aware of. Now, when you do this, as I said, do it for a minute or two. Be aware of what happens when you take your hand away. Immediately after you take your hand away, you might feel a wee bit of a lift in the skull, as if the head is going, ooh, as if the head was a balloon and it's about to take off. Okay, that's perfectly natural. Okay, that's just the Chinese say the yang qi coming up to the top of the head. Okay, so the next one, the third one, is called Renzong, which translates as the water trough, and that is GV26. So Feng Qi is GB20, Bai Hui is GV20, and Renzong is GV26. So as I just pointed to it there, your acupressure point for Renzong, the next one, is on the top of the lip. Okay, this is called the philtrum. Okay, and you're looking for a point below the nose, just where the nose meets the top lip, and where the lip itself starts here, that midpoint on the philtrum, you're finding that midpoint, and you're going to give a circular rub. quite difficult to do this and talk at the same time. And if you have a mustache, it kind of crinkles a wee bit. Now, when you do this, because you're pressing the upper lip into the teeth, it's going to be a wee bit sore. So don't press too hard. You don't want to be in pain, but you do want to feel it. So this one is a wee bit uncomfortable to do. And again, you only did it for a minute or two, or as long as you can stand. And you're looking for the midpoint between the base of the nose and the top of the lip, that midpoint in the philtrum, or the water trough, Renzong. Okay, now in China, they've done a lot of research, a lot of medical research into the effectiveness of acupuncture and acupressure for improving blood flow to the brain. And they've done transcranial Doppler scanning research and also advanced MRI mapping research, which proves that acupuncture at these points for somebody who has COVID or any other condition that causes, that affects blood flow to the brain, like a stroke, for example, that it does improve blood flow to the brain. So this does actually have an effect. So again, if you want to have a go, do so, but you do so at your own risk. If you have long COVID, I would definitely recommend you go and see your doctor. And if you want to have a go at acupuncture, I would definitely, and also other methods of traditional Chinese medicine, I would definitely recommend going to see an approved Chinese doctor. And I will put a link to the Association of Traditional Chinese Medicine and acupuncture in the comments below if you want to find a doctor in your local area. So there you go, a wee bit of information for you. We'll do another one. This is the first one I'm going to do on COVID and long COVID. I will do another one that's for the stomach, especially for people who have problems with hyperacidity due to long COVID. I will do one for the stomach in my next video. Okay then friends, thank you very much and stay well.